Good morning, Colorado. This is our regularly scheduled update on COVID-19. First, some good economic news. Our economy is roaring back, and there will be an additional reduction to the income tax next year for every Coloradan, every small business, from 4.55% to 4.50% for 2022. In addition, the average tax refund for every Coloradan will be about $70, about $166 for joint filers that will be going out when they file next year. So just another sign of the economic recovery. Unfortunately, we are still in very much the clutches of the health impact of the pandemic. We have 796 of our fellow Coloradans that are in the hospital now with COVID. And many will get better after an arduous fight, and some won't. We're going to lose some. Of the 796, 103 are vaccinated that are breakthrough. So to put that in perspective, about 75% of our adult population is vaccinated. Out of that 75%, three-quarters of our population, only 103 hospitalizations. Out of the 25% who aren't vaccinated, we have 693 hospitalizations. And what we're really seeing every day, this is a crisis of the unvaccinated. Even a subset of those who are vaccinated who have adverse effects are generally people who are immunosuppressed or have other conditions. While those who are vaccinated can contract the virus, there's a decreased likelihood, but they do, they have a much more minor impact of the virus, and so we really want to encourage everyone to get vaccinated. With regard to pediatric hospitalizations, there are 5 kids aged 0 to 11 in the state that are in hospitals right now, and there are 6 kids between the ages of 12 and 17. I would highlight that the vaccine is already available for those aged 12 to 17, and for that cohort, there is very close to 100% efficacy. So let me be clear, there is no reason for any child 12 to 17 right now to be hospitalized from COVID, because it is all but entirely preventable for that age group with the vaccine. It is even more effective for 12 to 17-year-olds than it is for 30-somethings, 40-somethings, 70 or 80-somethings. A little bit less effective as you get older. The vaccine is not yet available for 0 to 11-year-olds, and we hope that those 5 kids that are in the hospital get better, as well as the 796 adults. The 11 kids are part of that, so there's 785 adults and 11 kids. Trends, it's every day is another day of data. We're always hoping every time when it gets announced. We're going to be reporting more regularly, and we're going to provide a new graphical format on who the breakthroughs are, how it's happening, how there's so much greater risk if you're unvaccinated. We're going to put that data out there just so people can see that. It looks like it's potentially leveled off at a very high level. We're not seeing the growth in COVID cases we saw last week or the week before, but we aren't yet seeing a decline that we can identify. So I just want to encourage everybody to be careful, get vaccinated first and foremost. When you're around others in a group with a big crowd, wear a mask, and avoid large groups when possible. We're excited to be at Partners in Health Family Medicine in Westminster, Colorado, for a very exciting update. We're talking about our goal to vaccinate more people. And first of all, thank you to the people of Colorado for achieving 75% with at least their first dose vaccinated. That is a big milestone. We're on our way. We need to do even better. We're announcing a new partnership with doctors, family physicians across the state because of a couple things. We know that for that 25% that for whatever reason hasn't gotten it yet, different degrees of hesitation or procrastination. There are some that don't want to get it. It's a subset of that group, maybe half that group. But for the other part of that 25%, for that 10 or 15% that at least is open to it, the most meaningful conversation they can have is with their doctor, with their caregiver, discussing with them in the intimate, private setting why it's important, how this can protect them. They're accustomed to, of course, taking treatment advice from their doctor, prescription, an operation, things that are of much greater health consequence than a simple vaccine that might leave your arm sore the next day. But that is a conversation that can be had by the doctors. And we've had many practices that have stepped up and done that. And what we're announcing today is a new program to support our doctors, our family practices, our pediatricians in really being able to do the outreach that they need to better serve their community, to increase the vaccination rate among those that, for whatever reason, haven't been vaccinated yet. We're joined by several doctors with us today. You can tell by the white coats. Dr. Aaron Shupp, family medicine specialist with Rocky Mountain Primary Care. That's where our host of this facility is in Westminster. And Dr. Mark Moss, who joined us early in the pandemic from Pulmonary Sciences and Critical Care at Anschutz. They see the COVID patients on the wards every day. They've seen the number go up substantially over the last few weeks, and he wants to provide that stark warning for the people of Colorado. Because about 25% of the people in our state remain unprotected, unvaccinated. And we hope that this new partnership with the family doctors will be a good way to reach those folks. You know, practices can apply to participate in this. The program is live. They will get the doses they need, some financial support to do the outreach they need, even adding a staff person temporarily if they need it to schedule people or do outreach to people. The applications are open today through the end of November. They'll be approved on a rolling basis. We hope people don't wait till the November to do it. We need people to get vaccinated now. And the funds will go out on a first-come, first-served basis, again, to doctors' practices, private practices, family groups, pediatrician groups across the state is who that is going to go to. You know, when primary care providers, especially those in smaller practices, don't have the tools they need to offer COVID-19, it's really a missed opportunity. And that's why we've designed this program, to recognize that there are costs associated with administering COVID vaccines and to help our doctors on the front lines be able to do it. Yesterday I spoke with several primary care physicians across rural Colorado. One of them was Marcia Thorson at the Gunnison Valley Family Physicians. It really shows the hard work and dedication, and in many of our small mountain communities there might only be one or two docs in town, and they're relied on for everything. And as an independent practice in rural Colorado, Gunnison Valley Family Physicians has 5 physicians, and they work very hard to navigate the needs of the community. And now they're really excited to be part of the solution by making vaccines easily available and expanding their COVID vaccine offices in their Gunnison clinic. It was not previously available on site. We're going to see increased demand for vaccinations, really from 3 sources in the coming weeks. One is those seeking the booster shot, which has showed remarkable data so far, 97% efficacy on the Pfizer data. It showed more than 10 times boost in immune response. So that's very exciting for those who are in their 70s and 80s who have immune conditions. Please go out and get your booster. That is expected to be available to everyone by September 20th, 6 months after the second dose. We also are seeing increased demand from young people with school being back. As I indicated, it is sad to me that we have 6 people aged 12 to 17 in the hospital in our state because we should have 0. And none of them are vaccinated, the 6 that are in the hospital. And I know that there's a lot of interest in middle school and high schoolers to get vaccinated. We also expect approval for age 5 to 11, hopefully as soon as early to mid-October. We believe that data will be submitted to the FDA in September in a few weeks. Hopefully they'll review it expeditiously. We're also expecting increased demand because there are a number of employers across our state that have required vaccinations for many of their employees. A lot of those requirements are in effect starting around the end of September. And so a lot of folks who had been procrastinating will be getting that vaccine in September. So to reach that demand, of course, we have pharmacies. Of course, we have hospitals. But just as importantly, if not more, we have our private practices, and those are family practices across the state that do a great job. And in that vein, I'd like to introduce Dr. Aaron Shupp. Aaron is a physician right here at Rocky Mountain Primary Care. His clinic is eligible for funding under this primary care vaccination program. I expect they will be among the first to apply. And he's here to say a few words about the essential role of primary care providers. Your doctor, you know, where you go for your checkup, where your family goes, where your kid goes, and how they can give people a safe, convenient place to learn about the efficacy, the amazing results of protection from the COVID vaccine, and even have it administered. Over to you, Dr. Shupp.
Thank you.
right. Well, thank you so much, Governor, for your strong commitment to address the COVID pandemic here in Colorado. I'd also like to thank a special guest I have here today, Dr. Shannon Hill and her staff at Broomfield Family Practice. They have been the vaccine champions. Dr. Hill and her office manager, Kim, were instrumental in helping our clinic to become a vaccine provider here at Rocky Mountain Primary Care Partners in Health. I'd also like to thank the Colorado Academy of Family Physicians and our founder, Dr. Ingolstadt, her support of this vaccination process. And most importantly, I really want to thank the staff and volunteers that have been a part of our COVID vaccine clinics here ever since we started with our first 100 doses back in February of this year. We've now provided over 3,500 vaccine doses to our patients and hope to give ever more as our resources increase. So it's very important to understand that family physicians, pediatricians, and other primary care providers are the front line of public health in Colorado. We know primary care providers are among the most trusted source of information on vaccines and are instrumental in overcoming vaccine hesitation. I have a patient of mine that I've been taking care of for years, a gentleman, father of two, that began speaking with me about the COVID vaccine back in December. I treat him for diabetes, hypertension, and he told me, no way, there's no way I'm going to get this vaccine. Over the months, I've seen him several more times. In March, we spoke again, and I was able to provide some accurate information about the efficacy and safety of the vaccines, and he still told me there's no way I'm going to do this. In the interim between our next visit, his uncle passed away from COVID-19, and he came to me this summer and told me that he was worried and he was frightened about what might happen to him and his family. I told him that I recommended that he be vaccinated, and he still was reluctant to do so. And then just this month, past month here in August, I saw him again, and this time we talked about it, and he decided that it was time to get vaccinated. So both he and his wife came in, and they received their first doses. And so I think it's really important to understand that family practices like mine offer immunizations to many other preventable diseases, which makes us a natural place for patients to come to get their COVID-19 vaccine. And we're proud to have a relationship with our patients throughout the pandemic, offering COVID testing since 2020, March. And I think that being able to speak with your primary care provider and be able to go over the details of getting vaccinated and what risks might be, what safety issues they may have concerns about, and then making a good choice for them and their families. Oftentimes patients that are seen in other clinics that don't quite have the resources, like the needed staffing and equipment to store vaccines and conveniently provide them to patients, have to refer them elsewhere to another site to get vaccinated. They may have to make appointments, and it can be very difficult, especially in some rural communities. This new grant program for primary care practices to give the vaccine in their own clinics is exciting for its potential to provide additional points of access for patients that do want to get vaccinated. It's far easier for patients to get their vaccine right here today once we've had that conversation. And our clinic can use this grant funding provided by this new program to get every patient who wants to get the shot vaccinated. We'll be able to pay for things like staff time and technology to reach out to the patients we may not have seen yet. Many times patients are just looking for accurate information about the vaccine, how it works, and what side effects may be. The grant program will expand access for smaller clinics across the state, allowing for a broader distribution of vaccines to meet patients where they are. And the easier we can make it for Coloradans to get vaccinated, the better off we'll all be. And I'd like to hand it over now here to Dr. Moss.
Well, thank you. Governor Polis, thanks for the invitation to share my experiences from the front lines. As the head of the Division of Pulmonary Sciences and Critical Care Medicine at the University of Colorado School of Medicine and an intensivist at the University of Colorado Hospital, I've been personally caring for COVID patients over the last 19 months. When I think back to our previous press conference on March 30th of 2020, I realize our state and country are at an important crossroads regarding this pandemic that fortunately has at least one straightforward solution: getting vaccinated. In the intensive care unit, we have been caring for the sickest COVID patients as a unified and collaborative team, together with nurses, respiratory therapists, physical and occupational and speech therapists, pharmacists, dietitians, environmental service and transport personnel, and other support staff. ICU providers across the state have been working tirelessly on behalf of all COVID patients. It's been a privilege to care for these critically ill patients and help support their families in times of crisis. Caring for COVID patients has been emotionally challenging. Prior to the availability of vaccines, frontline providers were literally putting their lives on the line for their patients. However, there was a sense of purpose, driven by a common mission that COVID patients needed our help. It was what we were trained to do. We stayed in patients' rooms and tried to diminish their sense of isolation because their family members were unable to visit the hospital. We held a patient's hand and tried to provide reassurance, and sometimes we held patients' hands while they died. It's been an honor to witness my colleagues' extraordinary and relentless efforts. As the struggle to care for COVID patients continued throughout the fall, the availability of an extremely effective and safe vaccine, whose development is truly one of the greatest achievements in modern medicine, created a sense of optimism that the pandemic might end. After receiving my first vaccine shot in our hospital auditorium, I cried with joy when I realized I might not die in the line of service. And with a sense of relief, I immediately returned to the ICU to care for my COVID patients. There was hope. However, that December sense of hope now seems short-lived. Unfortunately, the pandemic rages on due to inadequate vaccine rates, resulting in many consequences. First, the care of non-COVID patients is being hampered due to the necessity to shift resources and personnel to care for COVID patients. Across the state, some elective surgeries are being postponed again to free up hospital beds and medical personnel to care for the COVID patients. Second, as the virus continues to mutate and surge, vaccinated immunocompromised patients are contracting COVID because inherently they are unable to mount a sufficient immune response. Third, as the governor mentioned, the number of pediatric COVID cases rises, and pediatric hospitals are starting to have to care for pediatric COVID patients. Fourth, patients suffering from post-COVID symptoms are seeking medical care at exponentially increasing numbers. As a result, the need for these post-COVID services is beginning to outstrip the supply of healthcare providers capable of caring for these patients. Finally, COVID has accelerated the parallel pandemic of psychological distress in healthcare professionals. The new wave of COVID patients in predominantly unvaccinated people may ultimately break the souls of my colleagues. We will continue to provide excellent care to our patients, though many healthcare workers are simply exhausted. According to recent studies, 1 out of 3 frontline healthcare workers are considering leaving their profession in the near future. Due to groundbreaking research, we understand the coronavirus much better than we did at the beginning of the pandemic. It is an ever-changing and elusive pathogen. Prior to the pandemic, I'd never cared for a husband and wife or 2 sisters in the ICU at the same time with the same disease. COVID and the Delta variant are still ravaging our communities and is not an individual rights issue, but a public health issue. The virus is the enemy. Even with our highly contagious Delta variant, the now FDA-approved vaccine is safe and and remains extremely effective for preventing severe disease and decreasing your risk of transmitting the virus to other people. The people who remain unvaccinated not only put themselves at risk, but also their families, their children, friends, neighbors, and other members of your community. The decision also holds the future of healthcare at risk as frontline workers contemplate leaving healthcare. This pandemic has caused enough economic loss, sadness, tragedy, and far too many deaths. On behalf of the tens of thousands of healthcare professionals in the great state of Colorado and the other frontline workers who have worked on your behalf, we urge you to get vaccinated. No one else needs to die from this preventable disease.
Thank you, Dr. Moss. You know, and as Dr. Moss really indicated, the virus is the enemy, and we have the secret weapon to defeat it. Thanks to the triumph of modern science, we have a highly effective vaccine that can defeat this virus, and yet we have a quarter of Coloradans who have not are not using that weapon yet. And we want to encourage them to join the fight against the deadly virus and take the steps to protect themselves and protect their families. Regular testing is also a good way to control the virus. We are offering free voluntary testing for all students in the state. All K-12 schools, private, charter, public, the school districts or private schools or charter school institute, they can enroll. In addition, I'm very excited to say that we are adding, thanks to the support of federal funds, an incentive for those who agree to be tested every week. And that means that the kids who get tested, because they're contributing to a public good in getting tested. I mean, it's good for their parents to know, but there's a public benefit in being able to isolate the virus early and prevent spread. There will be a $10 incentive payment per week for kids that choose to be part of this program and parents that sign them up. All students in participating schools whose parents have opted into the COVID testing program get a gift card of $25 and then a $10 a week incentive. Really, in recognizing of it, it protects all of us. That is valuable. That is something that is a worthwhile way to encourage testing. And we want to make sure that participating schools are also reimbursed for their administrative costs of COVID testing, just as we announced the program to support our physicians' practices around their cost of administering the vaccine. So the schools also get some funding for a position to help oversee it, and an incentive for the tests that are administered. So this can be a powerful and compelling partnership that will make our schools safer and reduce the spread of the virus across the larger community. We are grateful that this is fully funded by federal funds, a CDC grant, Center for Disease Control. And again, it's like with the vaccine, we have the weapon there, let's use it. This is another weapon that's here, let's use it, right? So school districts and private schools and others use this. It's compelling, it's exciting, it'll have an impact on helping you continue in-person education. It's voluntary, so it's not controversial in any community because those who want to be tested will. And there's some incentive and recognition of the public benefit that they are conveying by agreeing to make sure to identify COVID early. Finally, we are heading into Labor Day weekend, and that's a time that Coloradans like to get outdoors, which is great. We like to relax with friends and family. It's important to recognize that the Delta variant is prevalent at high levels in our community. So before sending out a lot of invites and firing up the grill, I want to encourage Coloradans to celebrate in small groups, perhaps your family, perhaps two families. We don't want massive block parties for Labor Day that lead to super spreader events and dozens of cases for those who might be unvaccinated at those parties. If everybody's vaccinated in your family, you can feel pretty good about it. If another family's vaccinated, hanging out with them. But keep the group, before we go back to our regular Labor Day, think about what you want to do this Labor Day weekend and maybe observe it with one other family or just yours or a few close friends instead of a larger event. especially if there are some of unknown vaccination status at that event. You can learn more at covid19.colorado.gov/risk-benefits just to learn about the science and the data that shows the different relative risks of different kinds of behavior. Certainly outside is better than inside as well. We have the ability to vaccinate everybody who wants to be vaccinated, to give a booster to everybody who wants a booster. We recognize that many Coloradans feel most comfortable going for medical care or advice to their own primary care provider, and that's why we're excited to work with, to support, and help mobilize our primary care providers across the state within the existing structure of doctor-patient relationships, giving them the support they need to get the vaccine out for that 10 or 15% of the population that might get it if they have the right conversation with a trusted medical professional that they know. While our Labor Day celebrations aren't quite normal, pandemics, don't take holidays, unfortunately. We want to make sure that we're thoughtful about how we are careful this holiday weekend and that we don't lead to another spike. As I said, initial data looks like current levels have stabilized. We watch that on a regular basis. We have not yet seen a decline. The last thing we'd want to see is Labor Day leading to another spike in our state to potentially jeopardize our hospital capacity. If you're still on the fence about getting vaccinated, talk to your doctor. There's no harm, no risk in having that conversation, but there's a lot to gain in sitting down and talking it through, like you would any other medical decision that you might be considering, a prescription they might want you to do, an operation they might want you to do. Colorado's primary care physicians are ready and willing to address your concerns. Have a safe Labor Day weekend, Colorado, and I'm happy to take some questions. Yes. Sí. Español.
So, Gov, if you could give a quick summary.
Yeah. Oh, okay. Sí. Estamos ayudando a los doctores para enlistar a ellos para ayudar a explicar los beneficios del vacuno a sus clientes. Y ahora tenemos dinero para dar porque ellos pueden añadir personas y, por ejemplo, si un practicio de doctores no tienen alguien que habla en español, ellos pueden obtenerlo con los fondos del Estado y entonces tener una conversación con sus clientes sobre la importancia y de recibir el efectivo, seguro vacuno.
Gabby?
Hey, Governor. We talked a good bit this week about that milestone that we hit as a state, that more than 70% of people getting at least one dose, but there's still about a 20% difference between the people who are fully immunized and the people who've only gotten one dose. So I'm curious, is it just a matter of time, people waiting in that waiting stage, or is there something more we can be doing to get more people fully immunized?
So it shouldn't be 20%. Let me get back to with that. It is so 75%. There's all different figures. So 75% is percentage of adults who have gotten at least one dose. The percentage of adults who are fully vaccinated is closer to 70%. Now, when you say eligible people, that means 12 and up, it's a little bit lower because we're at 54% of 12 to 17. And I'd have to back that into the other number, but it's probably 67, 68% or something like that. Then you say, what about everybody under 12 not eligible? And then that's a lower number too. So there's a number of different ways to look at it. We are obviously only able to give the vaccine to those who are eligible. And so, and then we also look at the adult population. But yes, 75% of adults have at least one dose. Over 70% of adults are fully protected. Somewhere in the high 60s of eligible Coloradans are protected. And the number of total Coloradans who are protected, we'll get to you, it's probably around 60%. Did you have a follow-up? Go ahead.
I was just going to say, is there something more we can be doing
Yeah.
to sort of close that gap a little bit?
There is. I mean, there are some folks out there that got one dose and for whatever reason didn't get a second dose. We encourage them to come back and get it. We also encourage folks who've had 2 doses 6 months ago or more, especially older Coloradans, to get a booster. Huge demonstrable benefits to the additional level of protection if they have a weak immune system. That's encouraged as well. And then, of course, we can do better among 12 to 17-year-olds because we only are at 54%. And it breaks my heart that anybody is hospitalized in that age group. And we have six 12 to 17-year-olds hospitalized with COVID. We don't need to have any right now. And so I really hope that, that if you haven't had the chance yet, get vaccinated.
Ivan from Denver 7, go ahead.
Hey, Governor, good morning. This mainly impacts those small clinics, right? And another question to add to that is, let's say people who don't have primary care doctors, they've already gotten their 2 vaccines, looking to get a booster now, could they then be, go to any of these primary care places and then get that booster, and would that be for free because of this grant money?
Yeah, it's free anywhere you get it. I'm going to have the doctor address it. So to be clear, it's free wherever you get it. Of course, people can go to pharmacies, go to hospitals, and each practice has a different way of dealing with, if you will, their non-patients. But I think most are happy to administer it to family members, people who are recruited by their patients, really almost anybody. But I'll let Dr. Strupp talk about that. Go ahead.
Well, that's a wonderful question out there, and ever since we started providing vaccines here at Rocky Mountain Primary Care Partners in Health Family Medicine, we've given over 1,800 vaccines out to folks that are not our patients, other people in the community, folks without insurance, and virtually anybody that wants it. And so even today, we are giving out vaccines, including boosters, to anyone that needs that. And that's something we've been doing since we've been able to provide vaccines. And so again, this grant program will really help avert some of the cost of that. A lot of clinics have a large percentage of their vaccines that are simply not reimbursed just because they're given out to folks that don't have insurance.
Yeah, and so this adds that level of reimbursement for people who don't have any other payer, or if they do, it's additional reimbursement. And again, there's some people that, of course, want to get it at a Safeway or a Walgreens, and that's fine. But especially for those who are somewhat hesitant, the intimacy and assurances they have of getting it in a doctor's office really helps them decide to do it. And so that's an important part of why we're partnering with doctors across the state. Next question.
John Engel from the Colorado Sun. I'm wondering if you can provide more information about how much money we're talking about being available in this grant program, where that money is coming from, and how many practices that might be able to cover.
Sure. So we will get you all that. It is all federal money, and we'll be happy to get you the particulars. The initial grants are between $50,000 and $120,000 per enrolled practice, and then on a per vaccine basis, they receive additional compensation. We approve them on a rolling basis. We think it's a good investment in increasing the vaccination rate, and they're fully funded out of CARES and Rescue Act dollars, and we'll be happy to provide those parameters to you.
Okay. All right, and with that.
Yes.
One more, last question from CBS 4. Michael?
Governor, if there are practices that are watching this and they just heard about this, how can they sign up to get money to?
Absolutely. Let me get the website. Do we have that here, Sam? Can we get the website so I can, and then I'll answer the question just from the get-go, because it is open, the website. Do we have that, Sam?
Yeah.
And then I'll give you a complete answer with the website in a moment. And it is first come, first serve on funding, and we turn it around very quickly.
Yep, it's COPCP.
Whoa. Say it again.
COPCPvax.com.
Oh, there it is. Can you hand that to me? Can't see very well without my eyes. Okay, it's simple. It's COPCPvax.com. Let me answer your question from the top. Here we go. For doctors and family practices to enroll, it's really easy. You go to COPCPvax.com. And you can sign up right there. It's rolling approval. Hopefully, practices will get the resources they need to do additional vaccine outreach within a matter of days or weeks. And that application is now open. We're really excited that across the state, a lot of doctors and practices are really thinking about what they can do to do more outreach to get that additional 10-15% of folks protected. Okay, thank you all so much. Have a great day.